Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic with Miss Cindy McIntyre. And Cindy came to see us back in January 2013. Cindy's here to share her story with us. So, Cindy, please do tell our audience a little bit about what brought you in originally, what you had been diagnosed with, and the kind of symptoms that you were experiencing.
Well, originally it all started with inflammation, basically throughout my body, but mostly in my hands. And it got more and more painful, and I've always been averse to drugs, so I started searching for a natural approach to help with my inflammation. The rheumatologist really couldn't give me a definite diagnosis. It's some type of inflammatory arthritis, but they don't know exactly what kind. But from what I've learned, it doesn't really matter what kind. It's the source and what is causing the inflammation that's the important thing.
Okay, so Cindy came to see us from out of state, and over 50% of our patients come to work with us from outside the state of Georgia. And so Cindy came to see us. We did a new patient evaluation, a physical exam, case history, and we ordered some lab work so that we could better identify what was causing your health problems. So Cindy, you and I worked together for a couple of months over email. We had some counseling sessions. I put you through a program, a specific individualized program to start to address the causes of your problems. And what kind of changes have you seen? How are you doing now as compared to when you came in about 6 months ago?
Well, my inflammation has definitely increased, but my digestion has really improved.
You said your inflammation has decreased.
Mm-hmm.
Yes, okay, and your digestion has improved.
Which I didn't mention, I've had IBS for 10 years, but that wasn't even one of the things I even thought about when I came in as something that would really improve so much. So that has improved a lot. My energy levels have just really changed, really improved. Just a little bit of everything. Even like my blood tests have come out really good.
How much would you say you've improved overall in percent since you started working with us?
About 80%.
About 80% in about 6 months.
Right.
It's not too bad. And as I was telling Cindy today, she's here for a follow-up appointment. So now that we're at the 6-month mark, we're not just getting symptomatic change, superficial changes, but we're actually getting changes at the cellular level. So Cindy's now starting to feel better, but at the same time, her chemistries are starting to normalize. Her sedimentation rate, which is a marker of inflammation, was at a 22, which is an elevated level. That was back in November of 2012. In April of this year, after we worked for a few months, it was down to a 2, which is almost perfect. Your CRP, which is a cardiac reactive protein, also a measure of inflammation. Originally a 6.3, very elevated. Now, as of April, 1.29. So we're actually getting objective measures of improvement along with symptomatic improvement as well, which is fantastic. So getting changes at the cellular level, at the root level, which is exactly what we want to see.
I'm happy to have the tools that enable me to have a healthy diet and also a healthy life.
Right, and that's important too, is that now that we're getting, we worked with Cindy for about 6 months, we're not going to be seeing Cindy as often anymore because we've now, like she said, given her the tools with which she can really take care of herself. And since, as Dr. Goldberg would say, we like to turn healthcare into self-care and really put the power back in the patient's hands. So Cindy, we really appreciate you joining us today. We appreciate you sharing your story with us. And like I said, we look forward to continuing to work with you and build upon all those good improvements that you've had.
Me too. Thank you.
Thank you.